Welcome back, and thank you so much for staying with us. Now we are going to be looking at accessible, affordable healthcare. Now, accessing affordable healthcare remains a major challenge for millions of Nigerians as the cost of medical service continues to rise amid economic hardship. From urban centers to rural communities, many citizens struggle to afford basic healthcare needs, leading to increased reliance on self-medication and traditional remedies. This discussion definitely is we are going to be looking at the barrier of affordable healthcare and the urgent need for effective government policies and community-based solutions. We are tying it down to the water crisis and how water crisis actually affects Nigerians in terms of, bringing in diseases to the country. And we have joining us this morning to discuss Evangelist Great Otosin, CEO Daily Lifesaver, also a coordinator eradicating water crisis. Thank you so much for joining us this morning.
It's my pleasure. Thank you so much.
Welcome to Daybreak Extra.
Thank you. Thank you so much.
So we are talking about water crisis and also looking at the kind of diseases that we see Nigerians always, have to deal with regards to affordable healthcare and, also taking like welfare generally. What are you doing, or what is your organization doing to see that this menace is being tackled?
Okay, basically, let's begin by saying this. That over 70% of today's crisis is caused by our drinking water. Now, the way out is, first, we should consider that your body is made up of 70% water. And if we must remedy anything that has to do with health, we must begin from the foundation, because if your body is 70% water, it simply means that your health is determined by the quality and quantity of water you drink every day. Today's drinking water is not like the days of our grandparents. Now, in those days, there were no impurities poured into the water, like whatever they are putting into the water, the waste and all that from factories. Today, we have to bring out this water from the sources and refine it and refine it. Now, in the process of refining this water, the vital natural minerals which would have improved our health are lost. And that is the root cause of today's problem, today's diseases. So we are here to let Nigerians know that we can tackle the health issue of our people when we create more awareness. Let people know the kinds of water we should be drinking. And also NAFDAC need to do more, because there are a lot of water companies today that their water are not even supposed to be in the market, but they are out there. Nigerians, there's so much poverty in the land, and a lot of people cannot afford drinking this bottled water. So majority of people are drinking sachet water or water from streams and other sources. So we go to different communities to create awareness, to tell them, now, the water we are drinking today is not the same of the one that our grandparents used to drink, because a lot of impurities have been introduced into our drinking water. And so you cannot drink the natural water. Also, when you treat your drinking water, we should know the level of chemicals added to treat today's drinking water. That is the root cause of today's problem. So that's why I always say that no matter how we struggle to help people to regain their health, it will not remedy it, because we are ignoring the foundation of health, being our drinking water.
Okay. Now, given that over 70% of households, especially in rural communities, lack access to improved water supply, what infrastructure models, e.g. Some models like decentralized system versus large-scale piping, have proven most effective and sustainable in those settings?
Well, majority of the pipe-borne water is not working. So majority of people are using borehole in order to sustain the water supply in communities. And there are many communities that they had boreholes 1, 2, 3 years ago. It got spoiled. And there's no
upgrade, no revamping, and nothing.
So those people return back to the natural sources, that is wells. They return back to streams and springs, if there are any. So these people return back to these things because there's no maintenance for these things. So it is really affecting our people. Now, I have seen a lot of people that were rich before, very rich, and because of their health crisis, they have all, squandered the money, wasted the money in search of health, and they are not seeing it. Now, it happened to me when I was growing up. My father became sick at some point. So we sold everything. My father was rich at some point, so we sold everything in search of how we can help. At the end of the day, after wasting all the money in search of health, we still lost him. So it simply means that if we are using our money to go to hospital, check up, and we don't have the value for that money spent, it means at the end of the day, everything will go and we'll still not get solution to the health crisis of our people.
So I would like to ask you, how does the quality of the water that people drink in the urban area differs from the rural areas?
Urban areas, we are basically concentrating on drinking bottled water. Now, in this bottled water, there are companies that produce them. They produce them in large quantities. And most of these people, they don't have a store, a way we can store the water. So they will keep under the sun, waiting for the logistics to take it to distribute. At times, these things will be there for 1 week or even more than 1 week. And when the sun keep hitting this water, it will ferment the chemicals used in treating this water into the water people will drink. Now, when the water gets to you, you may hold the water, preserve the water very well. But what happens before the water gets to you? How was it preserved? So these are some of the things that are really affecting our health in today's world. So we need to see how we can create more awareness, more and more awareness going to communities, creating different awareness for people to know that, even the water producers, to know that if you produce this water, don't keep them under the sun. Or even the large distributors, don't place them under the sun. It's affecting the health of Nigerians. So if this thing is not tackled, it will be very difficult for our people to be healthy. Very, very difficult.
So as a coordinator eradicating water crisis, what successful strategies have you implemented to encourage community participation in the management and maintenance of local water facilities?
Now, we have gone to different communities and we have run tests on their drinking water. And we have discovered that over 90% of what they used to drink is harmful to their health. Now, there's something we call alcohols that we add to your drinking water. That God gave someone an insight on how to produce a solution that can neutralize harmful chemicals in drinking water. That is enriching that water with vital minerals. Now, in 1951, a man called Dr. Pauline Linus made a discovery. He made it known that majority of diseases that people are going through today are caused by mineral deficiency. Now, if there are no minerals in our food due to chemical farming, and there are no minerals in our drinking water, how do we replenish these minerals in our body when we lost them, right? And as a person grows up, you need to replenish these minerals. Like calcium is a mineral, selenium is a mineral, chromium is a mineral. Now, these things, if they are not there, the deficiency of these minerals lead to a lot of health crises. So that's why you are seeing today. We need to go back to the source of our drinking water. Now, if the source is not okay, we need to supplement a product called alcohols that will help. And that's what we've been using to help the less privileged. And we're helping them free of charge to make their water healthy. And you see that people that will tell you they were suffering from particular health challenge for years, today they are relieved because of what we have handled the origin of the problems.
Yeah, so you talked about in the rural area we focus more on drinking bottled water and the rest.
No, in the
urban area, sorry, but it's different for the rural.
Yeah.
Should the government impose stricter regulations, when it comes to sachet water and bottled water companies?
This bottled water and majority of sachet water, they use chemicals like chlorine. If you search now, the harmful effect of chlorine to your body, you understand, for chlorine fluoride in order to purify this water. And if these things, they believe that if these things are not added to our drinking water, the water will not be as sparkling as to attract people buying it. But what are the harmful effects of chlorine when added to your drinking water? So we need to do away with chlorine, we need to do away with fluoride, right, in order for people to be healthier. But as far as these things are still there, these chemicals are still there in our drinking water, it's going to affect our health for a very long time.
So how can behavior change campaigns? I believe you have done one or two.
Yes, we have.
Okay. How can these campaigns effectively promote improved hygiene practices and sanitation behaviors, ultimately helping eradicating open defecation in, because this, when they defecate, it follows the streams, and you know the rural communities use this as a means of getting water, you know.
How can we, please come again with that question?
How can behavior change campaigns effectively promote improved hygiene practices and sanitation behaviors, ultimately helping
for over
eradicate open defecation?
Over 18 years, we have been going from communities to communities, Nigeria and Cameroon. For now, we have been going to create awareness, letting them know. And you know what people need to know. They say knowledge is power. People need to know, okay, the problem I'm suffering from, comes from this. You see, they will be more careful when they are. You know, they will not be as before. So we need to create more awareness, both online, offline, on TV, radio, to create more awareness, letting people know that what you're suffering from, it can be remedied when you reduce the risks of the kind of water we drink. And we also create awareness to also let NAFDAC and all the other bodies to regulate, properly regulate all this water we see on the streets. Yeah. So, and I have seen all this celebrated water, all this water that is big brands. We've seen people repackage them, not from the original source now. They get the bottles and repackage them. You think that when you see the bottle, this is what I used to drink, not knowing that it's not from the company. Do you understand? So these things are there. And you cannot compare the ones that come from the original company and the ones they are doing on the roadside or behind somebody's backyard. So Nigerians are doing a whole lot of things in order to make money. They believe that, okay, as far as water is clean, it's drinkable. But 80% of what people are consuming today, under my research, under our tests that we have conducted, is not drinkable. So by the grace of God, the people that we have made them know about this, they have all, you know, embraced it, and their lives are improved compared to how it used to be.
So, but do you think poor water quality is one of the reasons many Nigerians spend more on medical bills?
If your body is 70% water and your water fails, your health will fail. Because 70% is a pass mark. So if you fail 70%, you can't do anything to the remaining 30%. You can't. So majority of what people are going through today, if we can correct our drinking water, you see a lot of things will reverse. So what we are seeing today, we call them symptoms, we call them diseases, we call them water crisis. So if we can handle that, you see that all the symptoms, all the diseases we are experiencing today will be gone. Now, if you treat your drinking water, you lost minerals like magnesium. Deficiency of magnesium leads to high blood pressure. Deficiency of a mineral called chromium leads to diabetes. So if these minerals are not there, the body is made up of minerals. And it must be sustained. That's why you see that it must be sustained with minerals. You saw our grandparents lived. They didn't have this kind of flamboyant luxury life that we're having today. They were poor farmers and fishermen, but they live healthier than us. You see somebody.
And they live longer.
They live longer. Because if you live healthier, you live longer. Because if you do, a sick person doesn't live long. Any day, the thing can cut your life off. So you understand that today, majority of people that pass on today, it is untimely. So everybody will keep saying that, it's because he has been sick for years. And they try. But anybody that is healthy, that person is tend to live longer than the person that is sick. So that's it.
So what are the possible recommendations to overcome this water crisis?
The first recommendation is to create awareness. Telling people that, where are you drinking your water from? Let us conduct tests, community tests. We have been doing it, and by the grace of God, is giving us results. We let the royal fathers, our royal fathers, to know that we need to call our people, we educate them, and they will now go with that and spread the news. So that's how we've been doing over the years. We educate our royal fathers, and they will give us audience. In churches, we do it. In communities, we do it. In associations, we do it. So once we drop this message, they take it, and spread it abroad. And you see the people more conscious of the kind of water they drink. Then we'll now start talking about how we can make the one that is structured, the one that's available, that people are drinking. Because if this one is not good, if 80% of the water is not good, it definitely means you don't want they cannot drink from it. So we need to introduce these solutions to our drinking water, because it is not just African thing, it's not just Nigerian thing, it's what we call world water crisis. If you check it, it's online, that 80% of what, now 3 things that promotes good health: the air we breathe, the water we drink, and the food we eat. Yeah. So if the air is so polluted in Nigeria and other parts of the world because of air pollution, and people are inhaling it, the only remedy now that is left is drinking the right water that will help detoxify all those chemicals when it enters the body. So, but if you are drinking harmful water with harmful chemicals, you're also inhaling this air. You understand that the 2 major things now that's supposed to make you live healthier, these things are gone. Now check, what are they, how clean is the air Nigerians breathe? If you check it, you understand that a lot of health crisis is also from the air pollution. But you can't stop breathing. And there's nothing for now that can be done to control the air pollution. So the next available option or solution is water. Now, after water is food. The food now, from planting and everything, is chemically processed. Fertilizer, and we know these things are not good. So the only thing that is like the middle that is supposed to be the remedy is getting the right water. If you get your water right, whatever enters your body is the water that will detoxify it. Yeah. But if the water is not also good, all these 3 things jump together.
What simple household methods do you think people can use to purify the waters they use in their houses, especially if they are not sure of the sources?
When we were growing up, I was also told that we should use alum. This potassium, people know it's alum to purify drinking water. Alum is not also good because by the time you use it on snail, you understand what it does when it enters your body. Do you understand? So we have our way. Basically, we have our team as well to create more awareness. We teach people how to do it. Since we cannot do it here, there's nothing practically done here. We can help our people to get to know. We can help our people to get to know that they can make their water better, or they can structure their drinking water if the right things are done. Now we have a product. We have been using it for years now. NAFDAC approved. We have been using it for years now to help purify our drinking water, and it's called Alkafos. So if you check now, you see what we have done. Even if you go on Google now, you type the Daily Lifesavers, or you check www.dailylifesavers.org. You're going to see our activities for years. So by the grace of God, when we experiment it on, because most times when we go to communities, the royal fathers will say, okay, let them be the first to give a try on this solution using purifying drinking water. Now, that is the only solution we have been using to make water healthier, right? Because the awareness is also making people to, okay, where can we get this thing? So we make it available in different cities, different communities for people to have access to them, pending when we are going to. Now, if you have water-borne, what's it called, pipe-borne water, if we restore our pipe-borne water, you still understand that some of the pipes will crack, and then gutter, whatever, will go in there.
Yeah. The roast
so
also.
It's still not giving us the solution that we need, right? So this awareness, when we create more awareness, that a lot of people will get to know, okay, this is what we can do to our drinking water. In fact, if you get the best of food, the best of life without the right water, it's still going to be a failed health. So we need to start from our drinking water, create more awareness. We need to be empowered as well from government to empower us. We bring in youth. We also educate them. They go to different communities and create more awareness concerning water crisis. If we can, I used to say this, before I conclude, I used to say that the highest contributor to poverty is not lack of job, because Nigerians are trying. It is health crisis. Because you don't imagine somebody that make money for over 20 years and suddenly they say kidney failure. The money used in buying or replacing a kidney it has taken all your life savings. So there's a paper I read 3 years ago. It said nearly 10 million Nigerians have diabetes. And this is like 10 million Nigerians on a death row. Do you understand? Because if they say diabetes doesn't have remedy, doesn't have cure, it means that these people are just waiting for the time to go one by one. But I can tell you that if they are if they have a mineral called chromium in their system, it will help regulate that. That's what we do, right? When we introduce this aquifers to drinking water, it will supply the body with over 70 ionic minerals, apart from neutralizing chemicals from drinking water. Now, drinking the water that is ideal means that you have 70% in control of your health. So once we address water, I'm telling you, you'll be amazed.
Talking about what the government can do, you know, even though the rural communities are more affected by water crisis, we still have some urban areas that are affected. Take a look, for example, at Lekki. They're always in Lagos State. They're always the flood. And sometimes we have seen videos of people in Lekki opening their pipes and taps, and you see dirty water coming out. So now, how can the Nigerian government ensure better coordination between federal, state, and local levels to implement sustainable water management strategies?
Well, when it comes to urban areas, it's not that challenging as the people in the rural areas. Because it's urban people, it's easier for you to educate them. Maybe online, on televisions like this, it's easier for you to educate them than the urban area. There are people there that don't even have phone. They don't even listen to radio. Their duty is to go to farm, come back, go to market and come back. So these are the people that are more challenging to go to these communities. But the people in the urban area, we can easily, educate them in medias like this, newspaper and all that, letting people now keep hammering. Just like when there was COVID-19, they keep preaching, this is what to do, this is what to do. So we raise things like that will keep doing this. It's easier in the urban areas than in the rural areas. So the major work we have now, and you know that it's difficult for you to educate and illiterate people that don't understand your language. So you need to get someone from there that will be able to interpret to them. Oh, this is what these people mean. They will say, nothing is happening. I've been drinking this water. You not let them know. We keep telling them, this is your problem. And then when they see that the problem stays at their front, they will listen to you, if that will give them solution. Yeah.
So, but how, now before we let you go, how are women and children most affected, with regards to cleaner water and in terms of now talking about their health and their daily lives?
Yeah. Now, women that are mostly affected are pregnant women and kids. Kids have, majority of kids today, you see that they will do vaccination and all that, yet the kids, it's not like on the days of our grandparents. It was difficult in those days for you to see someone using CS to deliver. Now, when you drink this water is like alum water. What alum does to a snail is what the water will do when the child is about coming out, because water will come out first before, babies come out. And whatever the mother takes affects the baby, right? So if the mother keeps drinking chemically processed water without them knowing, a lot of these chemicals, the children or the fetus in their womb will take from there. So you see that a child that is 4 years have diabetes. How come? A child that is 4 years have a lot of health crises today. It was not like that in the days of old. Before, it was like, okay, you need to grow very old before you start experiencing health crises like diabetes, stroke. I have seen children experiencing diseases of old people in those days. So this thing all boils down to the kind of water we drink. If you don't have the right food, you don't inhale the right air, you need to have the right water.
Sorry, you talked about alum, what alum does to the snail. What does alum do to the snail for the sake of people watching? Because I know a lot of people use alum. If
you add alum to snail, it will cut off the sliminess. Yes, you shred it. So now when you consume, that is exactly what you do. Now, in your joints, your joint have something like that will make it lubricate the body, so to say, that will make it flexible. Now, if you drink an alum water, what it does to a snail, it will go to those joints
and cut off the lubrication.
You now see that it will become bone to bone. That's when arthritis comes in. Do you understand? The body, the fluid that was there,
the cartilage,
yes, it will take it off, and it now become, the bone will be scratching with bone. So you see that somebody will wake up and say, my body is aching me, simply because something like that we have consumed have removed those lubricants in the body. So it's really affecting our people, but a lot of them are not aware that this is why they are going through what they are going through, except awareness are created like this.
So, do you get feedbacks from the communities you go to create awareness to, and what are those feedbacks you get from them?
A lot of feedbacks, a lot. We have also put them online. We have met people before, 2 months later, drinking the right water. They will tell you, this is the review, this is how it is, God bless you and all that. It's everywhere. Now, if I can, when I went to Cameroon, there was war then, right? The person told me, please come and help our people, they are dying. They don't, whatever they are doing, a lot of people will tell you, all the money I saved is gone, but the disease is still there.
Still there.
I will just tell them, okay, let's correct the 70% and see what happens. So reviews are there everywhere, and I always say this, that if we have support of the government, okay, let's support this team, let's help eradicate water crisis. The conditions of Nigeria, the health conditions of Nigeria will improve. Because you can't expect me to be here no matter how much I make. They say my mother is sick. I will find a way, even if it's all the money, to rescue my mother so that my mother will stay a little bit longer, because of, I believe that my mother did a lot for me. I've not even done much, and sickness want to cut her life, short. So by me spending money on my mom or my father, it simply means that it's impoverishing me. So these are the things that we need to let our people know, that the majority of problems that people are going through that we are spending money on, if we can make our water right, a lot of people will be free.
Indeed. Thank you so much, Evangelist, for taking your time to be on our program today and sharing your insightful expertise on this matter.
Yeah.
Thank you so much.
Thank you.
Thank you very much for coming to Daybreak.
Thank you.
We've been discussing with Evangelist Great Otosin, CEO Daily Lifesaver, also a coordinator eradicating water crisis. I'm sure you must have learned one or two things on this discussion, but let's go on a quick break and we'll return. Let's take a look at what is trending on the social media platforms.